Hi, my name is Dee Dee Hesson, and I'm an occupational therapist at Cleveland Clinic Medina Hospital in Medina, Ohio, and I specialize in occupational therapy with neurological patients. So this slideshow and this presentation today is to just encourage you and teach you how to live well with the help of occupational therapy. So some of you may not even know what occupational therapy is and how it could benefit you. So that's what we're going to learn about today in this presentation. So occupational therapy, we focus on your occupations. Those are meaningful activities to you and how they affect the roles that you have. So you have a meaningful occupation would be being able to get yourself dressed or be able to do your own bills or be able to participate in your church services, something that is meaningful to you. So we occupational therapists like to consider ourselves professional problem solvers. We take a task that you're having trouble with, we analyze that task, we figure out how and why it's challenging to you, and then we will help you provide solutions for you to be able to participate in those activities and those occupations that are important to you. So we realize that solutions are not the same for everyone. We're not going to go tell your friend with Parkinson's disease, this is going to help them, because you guys could be in completely different stages and it's not cookie cutter. So we like to help problem solve your problem. So this presentation today is just to discuss how occupational therapy can help you live well in each stage of your journey with Parkinson's disease. So let's talk about being newly diagnosed with Parkinson's disease. I don't see too many people at this stage because you're not having too many difficulties at this point. So we think it's a great idea for you to come in to occupational therapy along with speech, along with physical therapy, to make it a multidisciplinary approach to get you an initial assessment. This is how you're doing today, August 29th, 2020. And on your journey, you will be able to see how you're doing last year, the week before, 2 years ago. And that will help, and it will also help establish rapport with your therapist, because we're on this journey with you. Some of the things we talk about when you're newly diagnosed with Parkinson's disease could be home modifications. This is how you can prepare your house for your journey before you even need it, before you even need to do it. We can tell you this is a good recommendation, remove the throw rugs, those types of things. Also, you're on these new Parkinson's medications. So we can help you set up a routine. Taking medications 4 times a day is not an easy thing. So we like to encourage you and help you with that. We do a lot of caregiver education, a lot of patient education during this stage. We realize that these new problems that you may be having could include fatigue, it could include depression, it could include anxiety, it could include being socially isolated from your family, from your work, from your church. So those are all things that we really want to encourage. We want you to stay as active as you can for as long as you can. And we want you to stay in the roles of an employee for as long as you can. So those are types of things we like to help you with. Through all stages of Parkinson's disease, we also will encourage you to participate in some form of exercise. At this stage, it's a high-level exercise that will challenge your motor planning. So middle stages of Parkinson's disease, you may not be experiencing like detrimental difficulties at this time, just maybe a little annoying things. You may come in and say, I'm having trouble buttoning. My hands aren't really coordinating that well, or zipping, or I may be having some urinary incontinence. What can I do about that? Or I'm having a hard time opening jars or doors. This may be a perfect time for a driving assessment to make sure that we can help you adapt your car and your vehicle to make you as independent and as long as possible. You may start having a little bit of cognitive problems, motor planning, thinking, processing, that executive functioning. Again, we help you to compensate for those things so you can stay in the roles you have as long as you can. At this stage of Parkinson's, we start to encourage large amplitude movement. So that's the big movement, that's the stretching. That's as your movements begin to get smaller and slow down, we will encourage you to do those large amplitude exercises. Occupational therapy will do most of the focus on the upper body, the arms, the shoulders, and the hands. Later stages of Parkinson's disease is when people are willing to try occupational therapy for the first time. Things may be getting a little harder for you. You may really have a hard time with feeding yourself or going to the restroom or dressing or bathing. But what occupational therapy does is to help you find ways to do those things so you can maintain your independence and maintain your quality of life. We have all kinds of adaptive strategies to use. We encourage stretching. We encourage using a shower chair and a grab bar if you need it for your bathing safety. But again, it's all tailored to you. And the goal is for you to be as independent as possible and to have a good quality of life throughout your journey. I just really want to encourage you, reach out to your doctor, find an occupational therapist, and set a rapport. Again, find an OT, find a PT, find a speech therapist that you can learn and grow with, because they're going to be with you throughout this journey. You definitely will need a prescription, so just talk to your neurologist about this. But again, I'm in Medina, and we have clinicians all over Northeast Ohio that would be willing to help you. And I just want to wish you good luck, and you got this.